Well, substance use is incredibly prevalent. So, um, both due to the sheer magnitude of substance use that occurs during pregnancy and throughout a woman's lifespan, and due to the consequences that substance use causes both during pregnancy and throughout a woman's lifetime, it's an incredibly important maternal health issue. Um, Up to 60% of women use some kind of substance at one period in their life. So it's something that we all should be thinking about. And that when I say substance, it's important to understand that we're talking about anything inclusive of tobacco, alcohol, and illicit substance use. COVID has had a significant impact on the prevalence of substance use and on the prevalence of the recurrence of substance use in women who have been in recovery. So both we see increases in recurrence, or what sometimes is termed relapse. We also see an increase in the new initiation of use among a lot of individuals. COVID has been incredibly hard on all individuals, and some of the aspects of COVID, such as increased unemployment, increased financial stresses, increased isolation due to the safety measures that are necessary for the virus. All of those things have really stressed and created a lot of kind of the adverse situations that can exacerbate substance use. So stress and the need for additional coping mechanisms is really has been at the forefront in COVID, and stress can serve as a trigger for women who use substances to resume illicit use. So in times of increased stress, in times of increased isolation where they don't have those traditional coping mechanisms such as in-person social support, quick ability to access in-person services. Those are all stressors for individuals because the mechanisms we've used in the past, which often involved kind of that person-to-person ability to connect with people, have been significantly impacted with COVID. And so therefore, we've seen a rise in a resumption of use among a lot of individuals. It is a disease, it can be a disease of isolation. So often many individuals use substances alone, or when they are alone. Those are times where whether it's exacerbation of depression, anxiety, even boredom, those types of things can trigger and cause the desire to use or increase in cravings. So the isolation that has often at times been necessary to mitigate the spread of the virus has had this incredibly adverse effect on creating situations that women can't easily get themselves out of. So in the past, if there were situations where you felt alone or bored or not having support, the intervention was to surround yourself with individuals or get yourself out of that situation as a way to deal with that as a potential trigger for cravings or resumption of use. And now those options are incredibly limited. So that it's almost like eliminating one of the ways that we have always worked with women to overcome potential triggers. So using video conferencing and allowing engagement in non-traditional ways, we have tried to use that extensively. But at a certain point, I think people in general really respond to in-person, person-to-person contact as really the most intimate and really often the most effective way to help somebody when they're dealing with a particular struggle or a particular difficult period of time. So to eliminate that kind of ultimate way to be able to share in each other's humanity and help each other with difficulty has been sacrificed, and I think to the detriment of certain disease processes such as substance use. isolation is not good for anyone. I think in addition just to the substance use component, isolation has put women at increased risk for violence. Dr. Chang has talked about that as well. So abuse and violence and really manipulation when you feel alone or you are actually physically alone from a partner, former partner, contact, even through like texting or phone interaction can be incredibly detrimental. So when you're isolated, those types of influences or potential triggers, I think, are more exacerbated. We also find a lot of patients struggling with childcare and issues related to kids being home from school, stresses associated with that, having to both feeling alone as an adult and then having to manage often multiple children, multiple responsibilities that they haven't had before, that really no one's had before, which is teaching, education, closure of childcare facilities due to COVID. And so that's a lot of increased stress and a lot of increased constant 24-hour childcare responsibilities that are new for a lot of patients who often may be in single family homes or single parent homes and are also trying to still go to work and generate income, frankly, to survive. So isolation and increased management of responsibilities related to childcare and school-related situations, we've also seen a lot of that. There's not a lot of great options. One thing we are trying to help women with is to kind of create a very small circle of individuals where you're contained in a bubble and you all understand what everyone else is doing outside of your intimate interaction, just to provide some of that help and relief. So if it's one family member or one friend or 2 or 3 individuals that you feel comfortable with being in person and helping with childcare or other responsibilities, almost in like a pod form, that can be effective to overcome some of these stressors, because at times you just need somebody to help you take care of your child. I mean, so trying to come up with safe solutions for that, even just getting to doctor's appointments or their treatment appointments, trying to help women negotiate that. There are a lot of childcare centers that have remained open, and we've been very aggressive with trying to help patients know those places and try to get their kids into some kind of care program during the day to help with those needs. But it's an incredibly, it's a challenge that a lot of women are dealing with. In a lot of ways. Women often are introduced to substances by an intimate partner in general, and a violent and abusive intimate partner. So it can be the mechanism for substance use introduction. It can also, when I say it, IPV or intimate partner violence, can also be a mechanism. Perpetrators can also use substances to control their victims. So substances, once a woman is dependent on a particular substance, the partner can use that substance to manipulate her behavior, her actions, whether or not she engages in treatment or not. So both as a mechanism for entry into the use process and as a mechanism of control and ongoing manipulation, even once a use disorder has set in, it can be incredibly intertwined. And having a woman having a substance use disorder, just having that diagnosis, because of the stigma associated with it, which is something that we fight against all of the time, partners can often use that diagnosis, not even just a substance itself, but just use the fact that somebody has that use disorder as a way to manipulate them or make them feel bad about themselves, make them destroy their self-esteem, make them feel not worthy of being a parent or a partner. So even having that diagnosis beyond just actually using substances to control somebody can be used by a violent or abusive partner to incredibly hurtful and harmful way that can have very long-standing repercussions. So it's very interrelated. We have very few patients who haven't experienced some kind of violence or abuse at one period of time. That's not to say it always goes hand in hand, but the prevalence of both co-occurring and that intersection is so common that if you're inadequately treating a patient, if you're not both evaluating a history or a current issue with abuse or violence as well as substances, they're so intertwined. To think that MWI is at the forefront of a lot of the substance use work that is going on today. We have multiple national multi-site clinical trials that are underway looking at new pharmacotherapeutics, new ways to treat from even a pharmacotherapy perspective, new drug formulations that we're trying to bring to the market to give women more options for therapy related specifically to opioid use disorder. We also have a lot of trials involving behavioral interventions to help women with additional skill sets beyond medication to help improve long-term outcomes in their recovery process. And we have a lot of trials and studies going on related to the comorbidities that are often associated with substance use. We have some very important early phase trials for hepatitis so that we can treat women with hepatitis C, which is a common comorbidity in substance use. We have ongoing studies related to helping support parenting skills and helping women develop mechanisms to help their child have a healthy environment. We're also looking at reproductive health behaviors, both during pregnancy and after delivery for women with substance use disorders, making sure that they have all of the reproductive health tools at their fingertips so they can make the decisions that are right for them about pregnancy planning. So both from drug development to behavioral interventions to associated comorbidities, I strongly believe that MWI is really leading the way and is at the forefront of creative and very innovative solutions to helping not just the use disorder itself, which is incredibly important, but really the whole picture. We're trying to help women and their families and really their long-term recovery trajectory and the whole picture. We have, there's a lot of resources that are available to women. So in the Pittsburgh area, they are welcome to call. We have a treatment program that's dedicated to women. And even if our particular treatment program at Magee and with Magee and the UPMC system is not the perfect fit for women, we can certainly help women find whatever treatment opportunity or resource would be the best fit for them. And that's the Pregnancy and Women's Recovery Center at Magee-Womens Hospital, 412-641-1211. Another resource that's important for all women or family members or friends is the SAMHSA website, which is the Substance Abuse and Mental Health Services Administration, which has a treatment program locator. So if you just go to the SAMHSA website and type in your zip code, it will pull up all of the treatment programs in your area, and importantly, the programs that accept Medicaid, which is incredibly important quality metric for the type of programs that are available. So that's available across the United States. And SAMHSA in general, again, has a ton of public information. It's similar to the CDC in its depth and breadth, and is a wonderful, very evidence-based tool for family members, friends, and patients who are looking at more information related to substance use and associated comorbidities that often go along with it. So that's an excellent resource in addition to patients or family members that may be in the Pittsburgh area. You know, stigma and language and how we refer to this particular medical condition is incredibly important. I think we We know through a variety of examples how important language is and how language matters and how that really impacts outcomes. And just terminology and ways of talking about substance use, using language that is non-judgmental, that is not oriented with blame, is incredibly important to make women feel comfortable about talking about what's going on with them. No one's going to talk to anybody if they feel like that they have a problem that is their fault, which is completely not the case. It's just like talking to, anyone should feel comfortable about talking about their diabetes or their high blood pressure, and we want women who have a substance use disorder to feel just as comfortable talking about that. Talking about insulin should be just like talking about buprenorphine or methadone. So not using terms like addict and thinking about it for what it is, which is, again, another medical disorder, and not creating a separate category to put this particular medical issue in is incredibly important. So the terms that are used, taking it very seriously, taking the treatment very seriously, because the treatment is highly effective. And wanting to talk to women about what's going on with them can really help somebody in their recovery process, because a lot of our patients struggling with self-esteem and self-confidence is one of the first barriers that we try to overcome. And that self-esteem and confidence comes through all interactions with all individuals, and that includes family members and friends. So supporting women in their treatment program, making them feel heard, always leaving the door open to talk about what may be going on with their recovery process is a huge step forward in really making this something that is no longer stigmatized and is something that everyone feels comfortable talking about at all times. I think similar to what Judy Chang said, I think it's really important for women not to feel alone. And that's important for all issues that all individuals deal with. So mental health issues, IPV, substance use, things that unfortunately have a degree of stigma associated with them. It makes women feel isolated. And the first thing I try to do when talking to an individual is first say, you are not alone, and then congratulate them on talking about it and making them feel proud of themselves for talking about it, for seeking to talk to somebody about it, for engaging in care, and just being really inviting and helping them feel confident about coming to a point where they feel comfortable communicating. But trying to eliminate isolation, trying to make women feel comfortable and create that space so that they can talk about what's going on with their life is the incredibly important first step. And when we're talking about pregnancy, it's important for women to feel very confident about their pregnancy and congratulate them on becoming a mom and having them feel proud about what they've done and what they've achieved thus far. So self-confidence, self-esteem, creating a relationship that's full of trust and that has no evidence of judgment or blame is the key first step, because you're not going to get very far if somebody feels that they're in a negative adversarial relationship.